Welcome to this first video on what's going to be a series of videos on pulmonary function testing. In this first video we're going to talk a little bit about lung volumes, and then in the next video we're going to talk about lung capacities, as we these are terms that we're going to use. I'm going to define them and then we're going to use them to describe a lot of the pulmonary function tests and a lot of the results that we get. So let's just look at this little sort of graph we have drawn here, and I want you to imagine that we have a patient or a volunteer or whoever's doing this, and they're hooked up to a machine which essentially records as they breathe in and out. So they have a mouthpiece and they make a seal on that mouthpiece, and then as they breathe in and out, the machine records the volume. So this, as they breathe in, the volume goes up, and then as they breathe out, the volume is going to come down, and it records that over time. So we get this volume against time plot. Right, so what this subject's doing is they're breathing just nice and easy. This is just easy resting breathing, in, then out, and then in, then out. Okay, and what we're doing is we're going to establish this baseline of this is their expiration, right? So if we can imagine, let's draw, maybe say that this is inspiration going up like this, and then as they exhale, this is our expiration. Okay, so this yellow line is just establishing this baseline expiration because we don't want any variance here. So they're breathing nice, easy breaths in and out. And then we ask the subjects to take a biggest breath in they can to fill their lungs all the way up until the top, until they can't get any more volume in. The biggest inspiration they can do. Okay, so this point here is going to be our max inspiration, right? And then we get them to completely empty their lungs, so they blow out all of that air that they've just brought in. They blow all of that out all the way down to the bottom until they physically can't push any more air out of their lungs, and they feel completely empty. Okay, so that point there is going to be their max expiration. All right, let's just put max exp for that. Okay, so we have, and then here they're just returning back to normal breathing. So that's a little maneuver which we'll go into more detail to eventually, but eventually what I want to do is define what some of these volumes are for the lung breathing. Okay, so here they're just taking nice, easy, normal breaths, and that normal breathing we call tidal breathing, or these would be tidal volumes. Okay, we call it tidal because of its sort of analogy to waves coming in and out, or however you want to look at it, but it's the normal breathing is what we call tidal breathing. So we're going to zoom in here, a bit of over zoom there, and we're going to start to sort of annotate this here. So let's pick a color. Let's go with this color. Okay, so this volume here, we'll do it on this one. These are the same. This is going to be tidal, so let's draw that here. Tidal volume. Okay, now this video is on volume, so this is our first volume we're looking at, and that's the tidal volume. That's that resting volume, just for normal, easy breathing, just like you're doing as you're sitting at your computer. You're just taking normal, easy breaths in. Those are tidal breaths, and it's important to note that this tidal volume is just one direction of here, right? So it's either the inspiration from this baseline expiration to end of sort of tidal inspiration. It's either this volume up, or it's the volume from there downwards. It's not up and down. That would be twice the tidal volume. Okay, so this sort of regular normal volume, that's what we call a tidal volume. Now, so as you're breathing normally, and as you're sitting there breathing normally, you could, if you wanted to, you could take a bigger breath in, right? Like that, the volume that you're breathing right now is not the max volume that you can possibly breathe. If you wanted to or needed to, you could take a bigger breath in than that regular breath, okay? And as we demonstrated, you can also take a very, very big breath in all the way up to the top here, okay? But there is this space in between your tidal volume and your maximum inspiration, all of this space here, where you could take a slightly bigger breath, or maybe almost a maximum inspiration, but not quite. So there's this room here for variance in the size of your inspiration. Okay, so we look at that almost as a reserve. Okay, so what we call this volume, from the top of your just normal tidal breathing up to your maximum inspiration, this is a reserve, right? This is just like an inspiratory reserve. So this is the inspiratory reserve volume. Okay, so, and really the definition of that is the volume that you can take above your regular tidal breaths. It's an inspiratory volume that you can take up and above your regular tidal volume breath. So the difference between your maximum inspired volume up here and your tidal volume is this inspiratory reserve volume, which we call IRB. Okay, so let's go to the next one. So then we have this expiration where we breathe all the way out to the bottom, right? We breathe all the way down to where we thought our lungs are completely empty. Now, if we look at this yellow line that we talked about earlier, this is just our baseline, or we could almost call this, actually let's rephrase that. I don't think baseline is the best word there. We're just going to call that just a resting expiratory level. Okay, resting expiratory level. Okay, and that's this yellow line here. So, and just like we can take a bigger breath above our tidal volume, we could also breathe out further than we want to from our regular normal breathing, right? If you just take a normal breath now and then at the end of your sort of exhale, just exhale some more, like there's space for you to keep breathing out if you want to, right? So again, there's this same reserve volume for our for expiration. Okay, so this is our expiratory. I'm just going to write EXP there. Expiratory reserve volume. Okay, just the same as our inspiratory reserve, but for the expiratory side. Okay, so this is the volume that we can breathe out above our just resting expiratory level. Okay, so this is our resting expiratory level. If we wanted to, we could keep breathing out here and keep going down, down, down. Okay, so that's our expiratory reserve volume. Now, what's going to happen next? Like, we know that, yes, that's good. So we know that when we breathe out completely, and I got the subject here to breathe all the way down to the bottom until he felt like his lungs were completely empty, was in fact, even though the subject may have felt like their lungs were completely empty, and this is truly the maximum amount that they can consciously exhale, there is another volume that remains in the lung all the time. There is a volume of gas in the lung which cannot be exhaled. It remains in the lung to keep the lung inflated and keep it recruited. And that volume is this volume. Okay, and it's called the residual volume. Residual volume. Okay, so it's almost just like a baseline resting volume which is always present in the lung. And that just stops the lung from deflating and the lungs from collapsing. If you imagine trying to blow up a balloon, like a party balloon, when it's completely deflated, it's actually quite difficult to inflate, right? You have to blow quite hard. But then once you get a little bit of volume into that balloon, it becomes much easier to blow up the balloon, right? And that's the same idea here, that you need that initial sort of residual amount of volume in the lung just to keep it sort of open a little bit, and that makes the lung more compliant and easier to open. So even though that this subject breathed out to what he thought was maximum expiration, and this is the maximum amount that he can breathe out, or she, there is a volume below that called the residual volume, which you cannot breathe out. And as we said, that's to keep the lung inflated and recruited. So what are our 4 volumes here? Let's just sort of label them. So we have one, our tidal volume. Okay, this resting volume. We have an inspiratory reserve volume. The volume above the tidal volume, which we can breathe in. We have the expiratory reserve volume, the volume sort of below the resting expiration that we can breathe out to if we need to. And finally, we have the residual volume. Okay, residual volume. That's the volume that remains in the lung at all times, keeps the lung at a sort of baseline level of recruitment, inflation, to enable the lung to inflate easier. So those are our 4 volumes. In the next video, we'll look at lung capacities.